Okay, hello, my name is Alisha Gupta, and I'm a junior in high school from Northwest Missouri. I'm excited to present my research project, which is a proposal for a scaffold-hydrogel injectable composite treatment for cartilage regeneration. But in other words, my research covers a minimally invasive design for a treatment that will regenerate cartilage tissue. Okay, so today in my presentation, I'm going to go over four main parts. In the introduction, we'll look at my research problem and what it targets. Then we'll take a deeper dive into what my research proposes in creativity and innovation, and a novel design treatment and procedures that I designed. And then next, we'll take a look at what the implications are in projected results and the relevance to my research problem. And finally, conclude with answering why is this research important, what did I learn, and what contributions does this have to the fields of medicine and health? So with that, let's begin with the introduction. So when I first started this project, I wanted to look at what are the main problems this world is facing with health and what implications does research have on these crises. So in particularly, I looked at osteoarthritis. Osteoarthritis is a big issue that's facing our country, or actually within the entire world. And we can see that mainly through how much of a debilitating effect that osteoarthritis has on the world, but then also how many people are affected. So osteoarthritis is a type of joint disease that results from the breakdown of joint cartilage and underlying bone, causing pain and loss of movement in the affected joints. It is often a debilitating condition and can have significant impact on quality of life. So according to the Osteoarthritis Action Alliance, 242 million people worldwide have symptomatic and activity-limiting osteoarthritis of the hip and or knee. Osteoarthritis is the third most rapidly rising condition associated with disability, just behind diabetes and dementia. Reduced levels of physical activity, comorbid conditions, and adverse effects of medications lead to a 55% increase in all-cause mortality. And while arthritis pain is extremely individualized, severe joint pain is not uncommon. Recent estimates suggest that 1/4 of all adults with arthritis experience severe joint pain, or characterized as a score of 7 or greater on the 0 to 10 pain scale. And so this is kind of what my research targets, because 99% of all hip and knee replacements are done to address pain and functional limitations. So in terms of that, that kind of prompted my research problem. How can we create a treatment that is minimally invasive and more accessible to people with end stage osteoarthritis? And that's kind of what led me to develop research within advanced innovative biomedical fields on how we can make a treatment that will be able to do this. So my treatment is a injectable treatment with three specific aims. So the first is the development of the injectable composite, which includes biomaterials that I will go through later. The second is cell culturing the composite, or making sure it can effectively regenerate the tissue. And finally, it is the implementation of the composite in the body. So with that, we can dive a little bit more into this. So my first specific aim is the development of the composite. And as we can see from the slides, it is called the Scaffold-Hydrogel. It both uses a scaffold and a hydrogel, which are two biomaterials that are very widely used within the biomedical field. So on the left, we can see the scaffold, which is used for structural support and integrity, and the hydrogels on the right, which are used for cell regeneration and biocompatibility. So this integration actually was recommended to me upon interview with a PhD student from Georgia Tech, and he actually said that using a scaffold and a hydrogel will have the best results if we're looking for a combination of these to regenerate cell tissue. So with that, taking a deeper look into the scaffold, we can see that it's a three-dimensional porous biodegradable made of polycaprolactone, or PCL. It's mainly used for cartilage regeneration as a structural support for cartilage cells to help them maintain their shape and organization. The scaffold is designed to degrade over time, allowing the body to gradually replace it with natural tissue. The PCL scaffold can provide a supportive environment for cartilage cells to grow and differentiate, leading to successful tissue regeneration. So this itself is going to take 25% of the open space and will be 3D printed. The rest of the 75% of space is going to be used within the hydrogel. This is a biomaterial that has been widely examined for and studied for the use of biomedical applications. And in this particular example, I use Gelma and PEGDA hydrogels, which are composed of a blend of the two biomaterials. They are versatile, biocompatible, and biodegradable. The hydrogel is used to deliver the cells and act as an environment for cartilage regeneration. It also is used to deliver nutrients and growth factors to the cells and to help support the cartilage forming process. So in the sense, the hydrogel is the main part of this component. The scaffold gives the mechanical structure and the integrity of keeping the joint open, while the hydrogel is actually going to regenerate the tissue when it's placed inside the knee joint. And these biomaterials are specifically recommended upon guidance from a professor at Duke University doing similar research. And it has shown that these are successful and compatible with cell growth and environment. So together, these create an injectable composite that can be used to regenerate cartilage tissue. Oops. Okay, so the second specific aim is the cell culturing component of it. For the composite to effectively regenerate tissue, it must undergo a process of cell culturing or growing cells in the environment before implantation. This is to support cellular regeneration and is done by two methods, using primary derived chondrocytes, which is cell method 1, and bone marrow derived stem cells, which is cell method 2. And these are used in a 1-to-1 ratio to ensure the best chance to regenerate cartilage. So let's take a look at cell method 1. Primary derived chondrocytes are cartilage cells derived directly from the targeted cartilage tissue and that are used to regenerate the new cartilage. Hydrogels can provide a platform for growth and differentiation of primary derived chondrocytes, allowing them to form and assemble into the cartilage tissue. The combination of the hydrogels and the primary derived chondrocytes have been shown to be an effective method for cartilage regeneration. And along with this, we have bone marrow-derived stem cells, which are cells that are derived from bone marrow. They have the ability to differentiate into many different types of cells, including cartilage cells. They can be used to regenerate cartilage by being implanted into the damaged area of cartilage via the hydrogels. And then they differentiate into the necessary cartilage cells and begin to form new cartilage and restore the damaged area. So these two paired side by side allow for the best type of regeneration that we're looking for when we want to see cartilage regeneration within the joints. So the final specific aim is finally implementation. This is what is very unique to this type of research and the procedure which involves the most innovative methods to create a minimally invasive treatment for cartilage regeneration. The scaffold, which is patient-specifically designed and 3D printed, is first placed within the deficit by surgical incision. Then the hydrogel is injected into it, which will then provide a suitable environment for the cartilage regeneration. So these two are very minimally invasive to the alternative that we see of complete and total joint replacement surgery. And this is again for end-stage osteoarthritis. So we can see most, if not all, the cartilage has been degenerated. And so by having this type of minimally invasive design, we can see that patients are able to regenerate their own tissue over time. And then the composite itself degrades. So then all you're left with is the cartilage tissue that was once there. Okay, so what can we expect from this research proposal and what are the implications of this research problem? So as we can see from the picture, from a similar study using PCL and Gelma using mesenchymal cells and chondrocytes, the pictures on the far right have successfully developed the most amount of tissue. And we can see from on the far right that this has the most amount of tissue, which is in green. So these cells have successfully been developed using these type of biomaterials, and is where we can see the most success. But another component we must look at is transforming growth factor beta 3, which is a very important protein that helps growth and division of cells. And this is important when we want to look at cellular regeneration, which again, we can see is very monumental in having this type of more cellular growth on the cellular level. And so using the transforming growth factor beta 3 along with the composite allows for the best circumstances and environment for cell growth. So quickly, let's answer the question, why is this research important and what are the impacts on the world and on medicine and health? So there are three main ways in which this research can benefit. We can see that it has a very large impact on osteoarthritis and being able to restore physical function. And we can see this by allowing it to have long-term relief from pain, swelling, and stiffness. And it also increases accessibility, meaning that more people are able to have this type of treatment, and it can reduce costs for people around the globe. And finally, we can see that the impact is the potential for using this method for many future types of treatment and research as well. This is the forefront of regenerative medicine and can shape the future of how we approach treating diseases and illnesses. These are my main references. I used a lot of studies in this so that it can have some kind of backup, and it has been shown to work a lot in the past, especially with these type of biomaterials. And with that, I'm thankful for being able to share my work and research on this topic. It means a lot to me, so thank you for your time, everyone.
Thank you so much. And thank you for showing me that it's possible to put GIFs into presentations. It's very fun to watch. We do have a question from the audience. So this question is, during your research, were you able to assess how accessible this treatment would be for the general population?
So back to my first slide, or one of my first slides, when I talked about how much of an issue this is for the people around the world, I specifically made this research so that it can also target those in developing countries as well, because one of the main issues we see is that a lot of developing countries aren't able to have access to like sterile surgical rooms and procedures. And so that's why in making this, I wanted the biomaterials in such that is like less expensive, but more accessible. So with that, we can see a lot of like efficiency and outreach to these developing countries, as well as like for people who are really suffering from this issue. And the flexibility with this treatment as well also provides more of that outreach that current treatments don't necessarily offer.
That makes a ton of sense. Thank you very much.